Diabetes, also called diabetes mellitus or DM, is caused by two different processes within the body. There is either the body doesn't respond appropriately to insulin, or the pancreas itself doesn't make insulin for the body to respond to. What insulin does is actually allow glucose or sugar from the bloodstream to go into the cells so that the cells can survive and do all their normal processes. When they don't have the insulin, they don't get the sugar. And the sugar then builds up within the bloodstream, getting high blood sugar level, which is how we help diagnose this. That sugar then spills over to the urine, and that's where you get the clinical signs that you see with diabetes, which is increased urinating, increased drinking, weight loss because the cells can't actually survive without the sugar, and oftentimes it develops into vomiting and diarrhea. These guys will drop a lot of weight. They'll actually start to lose their appetite instead of being ravenously hungry all the time. And then they can start to vomit and have diarrhea, and this is where we get into a big problem because they start to use the other stores in their body, such as the fat stores, muscle stores, and starches that their body normally has available without the blood sugar. We typically treat diabetes with injections of insulin and oftentimes with a diet change. If we allow these pets to go untreated, they can have many serious side effects. Their appetite will drop, they'll have vomiting, diarrhea, they can have ongoing infections, and this can eventually lead to serious derangements in their metabolism. In cases where pets are not treated for diabetes, they have a secondary problem such as urinary tract infections, skin infections, vomiting, diarrhea. Pets can start to use other stores in their bodies such as fats, starches, and muscle. In cases where fat is used, that fat is then developed into ketones, which can form acids in the body and deranges metabolism. And these cases need to be treated immediately because they can start to have such severe effects that these guys can actually go into a coma or death. It is something that you can test for at home fairly easily by testing their urine. If you notice any problems with ketones in their urine, we can bring them in immediately and start treatment. Other less serious side effects of diabetes are urinary tract infections, as we talked about, skin infections, but also in dogs, cataracts due to the large amount of sugar within the eye itself. These can lead to blindness, but caught early enough, sometimes we can remove them. The urinary tract infections can be a problem because they have the same signs as uncontrolled diabetes. These cats and dogs drink more, they pee more, although typically their appetite will be less or about the same, so that sometimes helps us differentiate. With these patients, we'll oftentimes check their urine regularly just to make sure that we're not missing anything and we're not missing a urinary tract infection. Dogs and cats actually have diabetes in two different ways. Dogs are what humans consider type 1 diabetes, where they're insulin dependent for their entire life. Once diagnosed, they'll always need insulin. In cats, they can have both what humans call type 1, where they're insulin dependent for the rest of their lives, as well as type 2, which means that sometimes we can manage these guys with diet alone and insulin for a period of time, but sometimes they can actually become undiabetic, what we call transient diabetic. This makes it worrisome for these guys if they actually lose too much sugar. If we're giving them insulin and they're no longer diabetic, they run the risk of what's called a hypoglycemic event, where we're giving them insulin and dropping their blood glucose so low that they can actually be very lethargic, not wanting to eat, in severe cases, seizures and coma. So we do monitor them very, very closely, and if you have any problems, if you're worried they're not eating enough, call your doctor and we'll talk about it first.